Why your blood pressure won't go down, even with medication and less salt. If your blood pressure has been creeping higher over time, there is something I need you to understand right from the start, and it may completely change the way you see this condition forever, because for decades most people have been told a very simple story, that high blood pressure is mainly about salt, eat less salt, avoid processed foods, and everything will improve. And while that advice is not completely wrong, it is dangerously incomplete, and that incompleteness is exactly why so many adults over 50 are doing everything they were told and still not seeing real improvement. And today I want to show you what is actually happening inside your body in a way most people, and even many doctors, were never trained to explain clearly, because once you understand this system, you will realize that blood pressure is not just a number, it is a reflection of multiple systems in your body either working together in harmony or slowly drifting out of balance. Before we go any further, I want you to do something for me. If you find this kind of clear, honest medical explanation helpful, take a second to subscribe to the channel, because my goal here is simple, to help adults over 50 understand what is happening in their body without confusion or fear, and to give you the tools to stay independent, active, and healthy for as long as possible. And if at any point in this video something resonates with you, leave a comment and tell me where you are watching from. I genuinely read them, and it helps me understand what people are going through. Now let me introduce myself properly. My name is Dr. David. I am a practicing physician, and for years I have seen the same pattern over and over again in clinic and in emergency care. Patients coming in with high blood pressure that seems uncontrolled despite medication, despite reducing salt, despite trying to exercise more, and what always stands out is not that they are doing nothing, but that they are being asked to focus on only one small part of a much larger system. So let's fix that today. To understand high blood pressure, we first need to understand what blood pressure actually is, because it is often misunderstood. Blood pressure is simply the force of blood pushing against the walls of your arteries every time your heart beats. And when you see a reading like 130/80, those two numbers represent two different moments in time. The top number is the pressure when your heart contracts and pushes blood forward, and the bottom number is the pressure when your heart relaxes between beats, and both of these numbers matter because both reflect how much strain your cardiovascular system is under. But here is what most people never realize. High blood pressure rarely causes symptoms in the early stages. There is no warning pain, no clear signal, nothing that tells you something is wrong, which is exactly why it is so dangerous, because while you feel normal on the outside, inside your body the constant pressure is slowly damaging the delicate lining of your arteries, the same arteries that supply your brain, heart, kidneys, and eyes, and over time this silent damage increases the risk of heart attack, stroke, kidney failure, and even memory decline. And I have seen this progression many times in real patients where everything seemed fine until suddenly it wasn't. Now here is where the story becomes much more important, because blood pressure is not controlled by one simple thing like salt. It is controlled by three major systems working together in real time. Your kidneys control how much fluid stays in your bloodstream, your blood vessels control how tightly or loosely blood can flow through them, and your nervous system controls how fast and how forcefully your heart is working. And when these three systems are balanced, blood pressure stays stable. But when even one of them is disrupted, pressure begins to rise. And when all three are influenced at once, chronic hypertension develops. And this is where most standard advice falls short, because salt only influences one small part of this system, while modern life influences all three systems at the same time. And one of the most powerful hidden drivers behind all of this is a hormone most people associate only with blood sugar, insulin. Now stay with me here, because this is where things start to connect in a way most people never hear explained clearly. Insulin is usually thought of as the hormone that controls blood sugar, and that is true, but insulin is also a master regulator that affects your kidneys, your blood vessels, and your nervous system all at once. And when insulin rises after a meal and then falls back to baseline, that is normal and healthy. But in many adults today, insulin never fully returns to baseline. It stays elevated for long periods due to frequent eating, refined carbohydrates, sugary foods, and ultra-processed meals. And when insulin stays elevated chronically, three major things begin to happen at the same time. First, your kidneys receive a direct signal to retain sodium, not because you are eating too much salt, but because your hormonal system is telling your body to hold on to it, and where sodium goes, water follows, which increases blood volume and raises pressure inside your arteries, and this is already enough to increase blood pressure over time. But there is a second effect, and this one surprises many people. Insulin also activates your sympathetic nervous system, the same system responsible for fight or flight, and when this system is constantly switched on at a low level, your heart beats slightly faster at rest and your blood vessels stay more constricted than they should be, meaning your body is living in a constant mild stress state even when you are sitting quietly. And there is a third effect, even more important than the first two. Chronic insulin elevation combined with elevated blood sugar creates oxidative stress inside the lining of your blood vessels, damaging the endothelium, which is the thin, fragile layer of cells that controls whether your arteries relax or stay tight, and one of its most important jobs is producing nitric oxide, a molecule that tells your blood vessels to relax and widen. But when this system is damaged, nitric oxide drops. Vessels become stiffer, resistance increases, and blood pressure rises even further. So what you are seeing here is not one pathway, but three pathways happening at the same time from one hormonal signal: insulin, kidneys retaining fluid, nervous system increasing vascular tone, and blood vessels losing their ability to relax properly. And once you see this clearly, it becomes very hard to unsee. Now the next question becomes extremely important: why would insulin stay elevated for so long in the first place? And for most people living in modern environments, the answer is not one single food. It is the pattern of eating itself: frequent snacking, refined carbohydrates, white flour products, sugary drinks, and ultra-processed foods that keep blood sugar and insulin rising repeatedly from morning to night without giving the body time to reset. And this is very different from how human biology evolved, because for most of human history, eating happened in cycles with clear breaks in between, allowing insulin to rise, do its job, and then fall back to baseline. But today many people are effectively eating every few hours, which means insulin is never fully switching off. Now I want to be very careful here because this is important. Not every person with high insulin has high blood pressure, and not every person with high blood pressure has high insulin, because hypertension is not a single disease. It is a final result reached through multiple different pathways, especially in older adults where age-related stiffening of arteries also plays a major role. But in modern populations, especially in people with abdominal weight gain, poor sleep, low activity levels, and processed food diets, insulin resistance is one of the central drivers. And this is strongly supported by the fact that metabolic syndrome, which includes high blood pressure, high blood sugar, abnormal cholesterol, and abdominal fat, is fundamentally a state of insulin resistance. Now here is something most people completely underestimate: ultra-processed foods are not just salty foods. They are engineered systems that affect blood pressure in multiple ways at once. They spike blood sugar rapidly because of refined carbohydrates. They remove fiber, which normally slows digestion. They often contain added sodium. They are low in potassium, and they are designed to make you eat more often than you should. So at the exact moment insulin is pushing your kidneys to retain sodium, ultra-processed foods are also delivering more sodium while removing potassium, which is the natural counterbalance mineral that helps your kidneys excrete sodium and helps your blood vessels relax. And this imbalance matters more than most people realize, because potassium-rich foods like vegetables, beans, lentils, fruits, nuts, and sweet potatoes actively support lower blood pressure by helping the kidneys remove sodium and improving vascular relaxation. Now let's pause for a moment and bring you into this directly, because I want you to think about your own routine for a second. Do you find yourself snacking often during the day, or eating something in the evening even when you are not truly hungry? Because if that pattern is present, it may be one of the hidden reasons your blood pressure is harder to control than expected, and I want you to reflect on that as we continue. Now the most important part of all of this is not just understanding the problem, but understanding what actually starts to reverse it. And the good news is that the same systems involved in raising blood pressure are also highly responsive to lifestyle changes. The first is food quality. When you replace ultra-processed foods with whole foods, several things happen automatically. Insulin spikes become smaller and less frequent, fiber slows glucose absorption, potassium intake increases naturally, and your appetite becomes more stable, which often reduces total calorie intake without any deliberate restriction. The second is meal timing, because when you reduce how often you eat, insulin has time to fall back to baseline, and your kidneys, nervous system, and blood vessels all get periods of recovery, and many people notice changes not from changing what they eat first, but simply from stopping constant snacking. The third is exercise, and this is one of the most powerful natural interventions for blood pressure, because physical activity directly stimulates nitric oxide production in your blood vessels, improving their ability to relax, and this effect happens even without weight loss, meaning exercise improves blood pressure through direct vascular changes, not just body fat reduction, and both walking and resistance training contribute significantly when done consistently. The fourth is sleep, and I want to emphasize this strongly because during deep sleep your sympathetic nervous system naturally switches down, blood pressure falls, and your body resets, but poor sleep or sleep apnea disrupts this process, keeping blood pressure elevated overnight and worsening insulin resistance the next day, which creates a cycle that is very difficult to break without addressing sleep itself. Finally, medication remains essential for many people, especially in moderate to severe hypertension, and drugs like ACE inhibitors, ARBs, calcium channel blockers, beta blockers, and diuretics are highly effective at lowering blood pressure and reducing the risk of stroke and heart attack, But it is important to understand that they primarily control the output of the system, not all the upstream signals that created the problem in the first place. So when we bring everything together, high blood pressure is not a salt problem. It is a whole body signaling issue involving insulin, the nervous system, kidney function, blood vessel health, sleep, diet, and activity all interacting at the same time. And the encouraging part is that many of these factors are actually within your control in practical ways. And when you improve even a few of them, the system often begins to rebalance itself naturally. And if there is one final thing I want you to take away from this entire explanation, it is this: the number you see on your blood pressure monitor is not the beginning of the problem. It is the end result of everything happening inside your body over time. And when you change the inputs, you can change the outcome, not overnight, but steadily and meaningfully. Take care of yourself. Stay consistent with the small changes that matter. And I will see you in the next video.